Hi, I'm Anita Bryant, and welcome to Life 360 Degrees, the televised survival kit. We look at life full circle, but from a different point of view. We help you to work with your bodies so that you can be healthy. We help you put your mind on the things that you can control, and we also show you ways in which to reconnect your spirit to its source. On this edition of Life 360, we will observe some practices that may not be familiar to you, but I assure you they're centuries old. On this show, we'll deal with energy, body energy. Our guests are experts in manipulating energy as alternative treatments. The ancient art of acupuncture is the needling of specific points, meridians of energy channels that run throughout our bodies. It goes back as far as the Stone Age in China, when they were using stone knives and pointed rocks for healing sicknesses, relieving pain and disease. It remained somewhat unfamiliar in the United States until about 1974, when a New York Times reporter named James Reston went to China and had a bout of appendicitis. He needed emergency surgery, and they didn't use chemical anesthesia. They used acupuncture. Well, he survived, he did very well, and from that point on, scientists proved that acupuncture works. We went to visit Dr. Marty Albring in her office and asked her to show us exactly what this acupuncture is about, and we even got to talk to one of her patients. Watch with me.
Well, acupuncture is an energetic medicine. It's based on meridians in the body that the Chinese were somehow able to figure out these meridian systems. It's like superhighways in the body, and they're energy. They're not nerve, they're not blood. They're actually energetic channels that what we call qi, the energy of the body, runs through. So it's again these superhighways of energy. And the Chinese believe that disease happens when these energetic channels become blocked or out of balance. So acupuncture is the medicine of accessing the qi in these channels to bring them to harmony or bring them to balance. Sometimes there's not enough energy in a certain area, and at other times there's too much. So acupuncture involves placing very, very fine needles into these acupuncture points on these meridians or channels. And then the combination of the points used is actually a prescription. So there are over 300 acupuncture points in the body, and so depending on the tongue and the pulse and palpation and asking questions, we decide what that prescription should be. And then the pins are placed in these points, and the patient will rest for 20-25 minutes while these points are communicating. So it's a very relaxing time. The patients, it releases endorphins, patients relax, and a lot of times they just fall asleep. And other patients will find that they feel very refreshed once they get off the table. So it's a kind of a little bit different experience for everyone. Until I get a chance to work with someone, I really don't know how they'll respond the first few times. But it's a very relaxing experience. And it's not painful. Most Americans are needle phobic, and they think we've got huge hypodermics, we're coming in there and it's really going to hurt. But I have patients as young as 4 that get acupuncture. My oldest patient right now is 93. And they all are very, very comfortable with the process.
A couple of the other girls on my tennis team had come in and met with Dr. Marty about issues they were having with tennis elbow and some other muscle issues. And so I decided that I would just try it, because I've always been a big fan of massage and some other alternative medicines. And so I thought, well, you know, this will round me out a little more. I'll try the acupuncture.
Acupuncture treats the whole body. So say if a patient comes in and they have asthma, then we will focus on that, but it can treat all types of things. In the case of, say, diabetes, it can improve the body's metabolism, not always to the point where they can come off their meds, but maybe reduce their meds. The most common things we see patients for is chronic pain. Most patients come through the door for back pain, neck pain, migraines, knee pain, those types of situations. But once we get them in the door, they can find out, as in Gloria's case, that we can help treat the fertility issues or you know, other imbalances. Acupuncture is awesome for menopausal women or for PMS or for infertility. I see a lot of allergy patients, especially here in the South. It's huge. So we do a lot of allergy work here. Other issues, I mean, everything from fatigue, fibromyalgia, which is a Western terminology. In Chinese medicine, we might find different underlying conditions. I might have 10 fibromyalgia patients, but I'll treat them all individually based on what I see with their each person's constitution. So acupuncture really can promote health and wellness in almost everyone.
We started treating my whole body, I think, which I think in modern medicine we don't really do that much. We just sort of treat one or two little things that are more symptoms than causes. And it seems like with acupuncture, you're treating your whole system, because we've worked on my sinuses, which I've had my whole life, and they're better. They're a lot better now. I don't get sick as much as I used to. We work on my neck, which I had whiplash about 15 years ago, and I've always had pain with my neck, and that is much, much better. We work on my TMJ, and that is gotten a lot better as well. I'm not clenching my teeth as much at night as I used to. So I think in general it just sort of relaxes your whole body. And when you're on the table, you get in a very relaxed state. So I think it's just kind of good for your whole system. I was supposed to have my left ovary removed, and I had a huge cyst. It was 7.2 centimeters, which is twice as big as my ovary. And in a few weeks, during the treatment, the acupuncture treatment, it went from 7.2 centimeters to 2.9 centimeters. So when I went in to my gynecologist for my surgery, my pre-op surgery appointment, she redid the ultrasound, and it showed that the ovary had, that the cyst on the ovary had reduced by over half. So we decided to postpone the surgery and have another look in 6 weeks, but we're very hopeful that'll be completely gone, and I won't have to have the surgery.
This is actually a cold laser. Okay. So it actually goes in and heals the tissue, where the hot laser or laser surgery actually destroys tissue. This frequency of laser actually heals the tissue. So I do utilize this in my practice, whether it might be for chronic pain. Say you have an arthritic joint, it can take the pain and inflammation out of that area. Sometimes I'll use it on a specific acupuncture point, or if I want to work on opening the meridian or the channel, I can take the laser and place it on the channel to help open up and bring energy into that area.
I actually do have a problem with that finger.
Well, let's fix it.
Yeah, let's do that. Yeah.
So you don't feel any heat.
Nothing.
Sometimes you'll feel a little sensation, but there really are no contraindications or side effects to this. You do not want to shine it in someone's eye. But other than that, it's a very gentle way to help the body heal.
So if I had a wound, then you would shine it on that wound?
It's excellent. In fact, it's FDA approved now in the United States for skin conditions. So that's been a change. Originally, the lasers came in from Europe and Japan. A lot of Oriental medicine doctors in Japan would use laser in their treatment protocol.
Well, for my long-time neck issues, I've used massage. I used to go once a week to get a massage, and that would kind of keep me going. But you know, every week the pain would kind of return and get stiff again and all of that. And I think with the herbal treatments that Dr. Marty gives me, in addition to the acupuncture, it really seems to have a longer lasting effect than just, you know, working out the kinks like the massage does. I still love getting a massage for sure, but I think that the acupuncture has a longer lasting effect.
Well, acupuncture can absolutely promote healing. Say in the case of maybe post-surgery, it can help with any type there's a trauma or time there's a trauma or surgery. There's a certain amount of stagnation or lack of blood and chi flow to the area. So what acupuncture can do is come in and stimulate the blood flow, stimulate the chi flow, so that the body can accelerate that healing process. So that's very common. I do a lot of times see patients both pre and post surgery, if that's the road they have to go down, to help stimulate their healing process. There are some different meridians that appear on the back of the body. The main meridian here is the bladder meridian. It actually starts at the very corner of the eye and travels back across the head, where it actually splits and becomes a double pathway for some time along the back. And it actually ends up clear down at the ankle. So if we were treating, say, a headache, we could use a point on the foot that would actually treat the head, because of the way these channels, these pathways work. So the other point we used on your hand was called large intestine 4. So that point on the meridian actually is very good at treating the face, treating sinuses, treating actually lowers blood pressure, and then combined with other points, it can be very effective for other things. So how the Chinese figured these pathways, these meridians, these channels out thousands of years ago, to me is fascinating. It's how they discovered it. They've shown with modern technology that these pathways actually do exist. They're not nerve, they're not blood, but they're actually channels of energy. I think acupuncture is becoming more and more accepted, even though in a lot of cases Western medicine doctors don't understand how it works, that they're seeing results, and they see patients asking questions about it, and, you know, would you think it'd help my case, especially in cases of chronic illness and chronic pain, where Western medicine might have tried surgery or drugs or medications and not gotten the results that they would have liked. Then they're opening up to trying other alternatives. I think that's getting more and more accepted. I have a patient that actually I talked to her neurologist just yesterday. She's in the Shepherd Center from a stroke, and the neurologist actually called me because my patient's family asked that I come into the hospital setting to treat her. And this neurologist is actually doing some acupuncture training. So she was pretty excited, and so I think those doors are opening. I think we're seeing in some areas more and more of these modalities being accepted in a hospital setting and in a Western medical setting. My practice here is with an MD, and we have a psychologist, and we have a personal trainer. So we've got a diversified group promoting wellness. I believe 42 schools in the United States now that teach graduate traditional Chinese medicine courses and classes. So going online and investigating that is a good thing. The other thing is go get acupuncture, try acupuncture, see if that's something that appeals to you. In most cases, I find people that get into this type of healing, it's more of a calling. It's much different than Western medicine. We don't see 30 or 40 patients a day. I see maybe 8 or 10 patients a day. Spend a lot more time with each patient. I also do herbal medicine, nutrition, laser therapy, neuromuscular therapy. So it's a combination of modalities that I find the most effective. But I think I've actually had some cases where I have inspired some people to go travel down this road and to become acupuncturists, and I think that's pretty exciting because we need a lot of us. There's a lot more interest.
If you'd like to contact any of our healers, please email us at ourvoicesspeak@gmail.com. Until next time, join us on Life 360 Degrees.